Assalamu alaikum wa rahmatullahi wa barakatuh. It has been a long time that I haven't uploaded any my lecture on my YouTube channel and on my Facebook official page. So again, I'm back to start the lectures and uploading on the YouTube channel, inshallah. So let us start with the new topic. So Bismillahirrahmanirrahim. Sallallahu ala Muhammadin wa alihi wa sallam. Today, what I want to discuss with my students, the topic is efficacy and the efficacy and potency. Actually, these are the two terms which are used in pharmacology and clinical pharmacy, and interchangeably these two terms are used, and many students might be confused between these two terms, that what is the actual definition of these words and where to be used and what is their actual meaning. So today I will try my best to discuss these two terms. One thing which I want to share, that students should remember that these two terms are actually used for the comparison of the drugs. When we are going to compare two drugs and more than two drugs, then for comparison these two terms are used, efficacy and the potency. So first I will talk on efficacy. What is efficacy? The actual definition of the efficacy. Efficacy we can define in this way, that efficacy is what? Magnitude of response. In simple words, I want to define in this efficacy term, magnitude of response. Okay, magnitude of response and drug causes when it interacts with receptor. You know very well that when we give a drug for any therapeutic purpose in body, that drug interacts and binds with their receptors, specific receptors. So when drug interacts with receptors, obviously it will cause a response, or we can say it will cause a therapeutic response, for which purpose we have given that drug. So how much that response has been produced, that the quantity or the magnitude or the amount, or how much percentage of that response is achieved or produced, that is known as the efficacy. So efficacy is what? Magnitude of the therapeutic response produced by the drug. So with an example, we can understand this efficacy much more. So I want to quote here an example. Let's suppose there are two drugs, drug A and drug B. I have told already that efficacy and potency are used for the comparison of the drug. So let's suppose there are two drugs, drug A and drug B. Both are given with the same dose. Let's suppose 10 milligram dose. Okay. And for what purpose? Let's suppose we have given drug A and drug B for PVCs. PVC is actually premature ventricular contractions. Premature ventricular contractions. So these are actually extra heartbeats. Okay, and these are produced in one of our lower heart pumping chambers. So to eradicate PVCs, we have given two drugs, drug A and drug B, with the same dose. So let's suppose drug A at the dose of 10 milligram has completely eradicated PVCs completely, or we can say 100%. Okay, what the actual problem? PVCs. We have given the drug A, and the drug A has completely eradicated the PVCs. On the other hand, the drug B, which we have given at the same dose, 10 milligram, let's suppose this has eradicated PVCs about 60%. So there are two drugs we have given at the same dose, 10 milligram, or any dose. I'm just quoting example here. So the drug A has 100% eradicated and drug B 60%. So when we will compare these two drugs, drug A and drug B, so we will say that drug A is more efficacious than drug B. Why? Because we have used the same dose, but the drug A has produced maximal response. The magnitude of the amount of the response, that is 100%. And the drug B, the amount of response is 60%. Means still 40% PVCs are still over there. They are not eradicated. They are not being cured with this drug at this dose. Okay. So in this way, we will say that drug A is more efficacious drug B by comparing the magnitude of the response. Okay. So till this one, I think that the concept and the definition of the efficacy has been determined clearly. Okay. One more thing which I want to share with you people regarding the efficacy, that is that efficacy, this depends upon, if I say efficacy, or if I say another term or another statement, magnitude of the response. If I'm saying magnitude of response or efficacy, both are the same thing. Okay. So efficacy or the magnitude of response, this depends upon two things. Number one, number of drug plus receptor complexes formed. Number one. And number two, efficacy depends upon number of drug plus receptor complexes formed. Obviously, you know very well that when the drug goes inside the body, so there are the receptors, and with receptors the drug has to bind. Okay. So how many drug receptor complexes are formed? This is one of the significant point for producing any therapeutic effect. So the efficacy depends upon this thing, number one. Number two, intrinsic activity of drug. Okay, these are the two main things. Only the drug receptor complex formation is not sufficient for producing the efficacy. But another important thing, that is the intrinsic activity of the drug. The drug must possess the intrinsic activity. Now, what is that intrinsic activity? I will tell later. So, come on to this point. Number of drug receptor complexes formed. Now, this itself depends upon two more things. Number one, sensitivity of receptor with drug. Number two, concentration of drug at receptor site. Obviously, the drug will make complex with receptor in that situation if the sensitivity of the receptor will be with the drug. If the receptor is not sensitive, if the receptor is not attractive towards the drug, and the drug is not sensitive towards that receptor, so obviously there will be no any complex formation. The drug will not bind. Obviously, every drug has its own specific receptors to be bind with them. So there are multiple receptors in body, but the specific drug has a specific receptors to be bind. So if there will be sensitivity of receptor with the drug, obviously there will be the complex formation of drug with the receptor. So the number of complexes formed depends upon the sensitivity of the receptor. Let's suppose if there are 100 receptors and 100 drug molecules, but out of them only 50 receptors have sensitivity towards the drug molecules. So obviously there will be the 50 number of drug receptor complexes formed. Remaining 50 drug molecules will be on the other side, obviously, because there is no more sensitivity of further receptors to be bound with the drug. So obviously the sensitivity counts a lot. Number one. Number two, concentration of drug at receptor site. Let's suppose same example I am quoting here. There are 100 receptors and there are, let's suppose, 20 drug molecules, and 100 receptors are sensitive towards the drug molecules, but only the drug molecules, the concentration of the drug molecules to the receptor site is 20. So obviously how many complexes will be formed? Only 20 complexes will be formed, because the drug molecules are 20 and the receptors are 100. So obviously 20 complexes will be formed. But if we will increase the concentration of the drug towards the receptor side, so obviously more number of complexes will be formed. So concentration of drug at receptor site and sensitivity of receptor with the drug, these are the two main concepts for the producing the number of drug receptor complexes formed. Now further, this concentration of drug at receptor site, this itself depends upon two more things. Number one, dose of the drug, how much dose we have given into the body. If we are giving less dose, obviously less amount of the drug will be reached toward the receptor site. Number one. So, and if we are giving much more dose, so more concentration of drug can reach over the receptor site. Number two, pharmacokinetic profile. Obviously, this also counts a lot. Pharmacokinetic profile of drug. These two things are most important. Dose of the drug, pharmacokinetic, you know very well pharmacokinetic profile. For example, if you have given the drug through IV, obviously there is 100% bioavailability. But if you have given the drug through the oral route, obviously the bioavailability will be changed, because now the drug has to cross multiple steps of the pharmacokinetic profile, absorption, distribution, and so on. So each drug might have different pharmacokinetic profile. So that steps of the pharmacokinetics might influence, might interfere, okay, with the net concentration of the drug at the receptor site. So how much drug is reaching towards the receptor site, this depends upon the pharmacokinetic profile. This is a little bit much more topic, we can talk on that one, but today it's not our topic to discuss on pharmacokinetic profile. But up to now you can understand this one. So dose of the drug and pharmacokinetic profile, these two can influence the concentration of the drug at the receptor site. And the concentration along with sensitivity of receptor, these two can influence the drug receptor complexes formed. Okay? And complex formation along with intrinsic activity, these both can influence the efficacy. What is the intrinsic activity of the drug? Actually, this is not enough that the drug has bind with any receptor. The binding of drug with receptor, this is not enough to produce the efficacy, to produce the response. But there is a need that the drug should have the ability, the drug should have the capability, the drug should have a power to activate the receptors. The receptor activation is also required to propagate the response, to propagate the signals and so on further steps. So only binding of the drug with the receptor, this is not necessary, but activation of the receptors is also necessary to produce the therapeutic response or to produce the efficacy. You know that agonist and antagonist. So this is a little bit side by topic, but from here you can. What are the antagonists? So antagonists are also the drugs which are going to bind with the receptors, but they are not going to activate the receptors. Okay, they are just going over there and sitting on the receptor side, and they are not allowing the agonist drugs to bind with their receptor, because if agonist will bind, it will activate the receptor. So what the antagonists are doing, they are just occupying the space of the drugs, so that that actual drug, that agonist, should not get the space to bind with the receptor, because if agonist will bind, it will cause the activation of the receptors. If receptors will be activated, therapeutic response will be produced. So activation of the receptors is also required. So this activation of receptors by the drug is known as the intrinsic activity of the drug. So I think that the concept of efficacy is clear up to now, and now we can come on the potency. What is potency? Potency is also a term which is used for the comparison of the drugs. So we can define potency that this is the measure of amount of dose. ठीक है? Measure of amount of dose that is required, or that is necessary to produce effect, or we can say to produce the maximum response, or simply we can say that to produce the efficacy, to cause the efficacy. So for efficacy, for producing the therapeutic response, for producing the required therapeutic response, how much dose of the drug should be given, or that is necessary, or that is required. So the measurement of that amount of dose, okay, is known as potency. So potency relates with the dose, amount of dose. Okay, measurement of the amount of the dose is known as the potency. We can simply understand this with an example. I'm quoting same an example. PVCs, premature ventricular contractions. For eradication of this one, to eradicate PVCs, let's suppose drug A and drug B. Okay? Drug A, let's suppose we are giving at 10 milligram, drug B we are giving with 20 milligram. Here the dose of the both drugs is different, okay? And these two drugs are producing the same efficacy or same therapeutic response. Okay? मतलब the magnitude of the response produced by these two drugs is same. Let's suppose PVCs are eradicated 100%. Okay? Drug A has also 100% eradicated PVCs, and drug B has also 100% eradicated PVCs. But now here what the point we have to check, drug A has been given at the dose of 10 milligram and this drug B at the dose of 20 milligram. So we will say drug A being less in amount, being less in the dose, has the 100% efficacy, and drug B being much more in the amount has also produced the same efficacy. So if we will compare these two drugs, obviously we will say drug A is more potent. The power of the drug A is much more as compared to drug B. Drug A being less in amount has the same ability, has the same power, has the same capability to activate the receptors and to cause 100% eradication of the PVC. And compared to drug A, the drug B, this has also caused 100%, but at the dose of 20 milligrams. So here, by comparing these two drugs, we will say drug A is more potent than drug B. Okay, so this is a little bit about potency. We can also understand this one by a graph. Let us draw a graph and understand this efficacy and the potency. Let's suppose here drug concentration, let's suppose 5 milligram, or directly I am writing 10 milligram. Okay, this is 20 milligram, this is 30 milligram, this is 40 milligram, and here is what? Here is maximum response. Okay, in percentage, or you can say efficacy or the therapeutic response. Let's suppose 20%, 40%, and 60%, 80%, and 100% response. Okay, let's suppose drug A and drug B. Okay, drug A at the dose of 10 milligram has caused 100%. You will say 100%. This is drug A in red line, and drug B at the dose of 20 milligram. Here 20. This is drug B. Okay, you will say that the percentage of the response is same 100%, but drug A at the dose of 10 milligram can achieve this one, and drug B at the dose of 20 milligram has achieved this efficacy. Okay, so by watching this graph, we can understand the potency. Okay, one more thing. Let's suppose there is the drug C. Okay, and drug C at the dose of, let's suppose, 40 milligram, 30 milligram. We are highlighting 30 milligram. At 30 milligram, it has caused 60% efficacy. 60%. So here, this is drug C. Here we will say that drug C is less efficacious. Why? As compared to drug A and B. Because drug A and drug B has efficacy of 100%. The magnitude of the response is 100%. And the drug C has the magnitude of response 60%. So drug C is less efficacious as compared to drug A and drug B. Also, drug C is less potent because even for producing the 60% efficacy or 60% therapeutic response, the drug C has required 30 milligram. This is much more amount. Okay, 10 milligram and 20 milligram, these two drugs has produced 100%, but this drug has required 30 milligram even to reach up to the magnitude of 60%. So the drug C is also less efficacious and less potent as compared to drug A and drug B. And drug B is less potent, only less potent than drug A, because the drug B's response is also 100%. So drug B's efficacy is equal to efficacy of drug A. These two drugs have the same efficacy. So these two drugs regarding efficacy are equal, but regarding potency they are unequal. How? Because drug B, for achieving the magnitude of response up to 100%, the drug B required 20 milligram. So this is the capability of the drug, that for producing 100% efficacy, the drug B is required in 20 milligram to achieve this therapeutic response. So I think from these graphs and examples, you have got the point. Regarding potency, there is one other way we can define and we can understand potency. Actually, potency is what? Potency is also determined by another statement. That is, the potency is what? Potency is actually the dose of drug that is required to achieve 50% of the desired therapeutic response. जो भी therapeutic response है, so the 50% of that therapeutic response. If we want to achieve 50% of total therapeutic response, so for achieving that 50%, the amount of dose that is required or that is necessary, that amount is known as potency. So this is also called effective dose. Potency is also called effective dose 50 or ED50. ED50, effective dose 50. Effective dose 50 means 50% of the total therapeutic response, total desired therapeutic response. So you can say that ED50 is what? ED50 is a dose, okay, producing 1/2 of the total therapeutic response. 1/2 of the total therapeutic response. You can define potency in this way. Or simply you can say the potency, this is the concentration of the drug producing the 50% of the maximum response. The statement is same. Dose of the drug that is required to achieve 50% of the desired therapeutic effect, or simply the concentration of drug that is producing 50% of the total or maximal therapeutic response. So इसको हम ED50 या effective EC50 concentration, if we will use the term concentration, we will write EC50, or if we will use the term of dose, we will write ED50. Effective dose 50, effective concentration 50. Means that concentration, that dose of the drug which is enough to produce 50%, 1/2 of the total or desired therapeutic response. We can understand these statements we can understand through a graph. Let's suppose there is a graph. This is 0%, this is 50% of the therapeutic response, this is 100%, okay? And there are two drugs, drug A, let's suppose drug A, okay, and drug A and drug B, okay. Let's suppose both have the same efficacy 100%, but by that statement which we have previously said, that the dose that is required to achieve the 50%, okay, so we will say 50%, this is the 50%, okay, so we will decline this one here. Let's suppose here this is the concentration we have, let's suppose 5 milligram, this is 10 milligram, this is 15 milligram, this is 20, and For this one, if we will decline this one up to now, this is 10 milligram. So here you can see that this is drug A, this is drug A, and this is drug B. Okay, drug A has achieved 50% of the therapeutic response at the dose of 5 milligram. At the 5 milligram, this drug has achieved 50% of the therapeutic response. This is the total therapeutic response 100. Okay, the drug has reached up to 100%. The efficacy is 100%. Okay, but for reaching the 50% of the therapeutic response, that drug has needed 5 milligram. At the concentration of 5 milligram, at the dose of 5 milligram, that drug has achieved 50% of the therapeutic response. Okay, as compared to drug A, the drug B. Okay, see here that drug B has achieved 50%, okay, of the therapeutic response, but at the concentration of 10 milligram. So there are two drugs, drug A 50% therapeutic response at the dose of 5 milligram. Okay, and drug B 50% therapeutic response at the dose of 10 milligram. So if we will compare these two drugs, obviously drug A is more potent than drug B. Okay, more potent than drug B. So this is also the concept. And for calculating the potency, that how much drug A is potent than drug B, so this may be quantified by ratio. How? You will write down the ED50 of drug B divided by ED50 of drug A. Let's suppose ED50 of drug B, let's suppose ED50 of drug B is 20, ED50 of drug A is 10. So if you will divide, obviously there will be 2. So you will say drug A is two times more potent than drug B. So this was all about the efficacy and the potency. Hope that you all have understood and you all have made your concept clear regarding the efficacy and the potency. So inshallah, with further other more topics, we will be connected to our this YouTube channel and my official Facebook page, Dr. Syed Mubashir Official. Till date, Allah Hafiz, Allah Nigabaan.